Hi everyone, I am here with the owners of VIP Home Healthcare of Cuenca. This is Bruce, Pauline, and Vinu, and they are going to tell us more about VIP Home Healthcare and all about things related.
Okay, well, thank you. Thank you for having us. And VIP Home Healthcare is really the premier home healthcare company in Cuenca. And we started this company, VIP Home Healthcare, about a year and a little bit more than a year ago, because there was just a whole lot of demand here. Mm-hmm. Pauline was doing home healthcare on her own, and she realized that there was a lot more demand than what one person could do. I have a business background, and so does Vinu. And so we decided together to start a company to meet that demand.
Can you tell us a little bit about your backgrounds?
Sure. Okay, so I'm Bruce, and I am an MBA, Master of Business Administration, and with project management certification, and I've done a lot of work in tech and U.S. companies, and so that's kind of my background. How about you, Pauline?
I'm Pauline. I'm an RN and licensed to work in Ecuador. I'm from India, and I moved to Ecuador 3 years ago. And I have had 3 to 5 years of experience before I came here in intensive care unit and heart and lung transplant unit.
Wow.
So I have completed almost 50 to 60 heart and lung transplant before I came here.
Wow.
Yes.
That's a lot.
I'm Venu. I have my MBA in finance and marketing. I moved in Cuenca almost 3 years ago. I have several years of experience in different business in India and Ecuador.
Great. Well, it's nice to meet you all.
Thank you.
Thank you. And what types of services do you provide?
First of all, I would say medical care, and this is real professional care, IVs, wound care, some injections,
physiotherapy.
And a lot of times this is post-operative care of various types, as people are not wanting to spend time in the hospitals. Hospitals are cheap here compared to the States, but it adds up. Yes. And we've had clients who are $20,000, $40,000, that kind of thing, from 2 or 3 weeks of intensive care in the hospital. Well, if they can do some of that at home, it really starts to save money. Then we do just health care of various types. Now, this is things like helping people to get dressed, brush their teeth, use the restroom, and then we have home care. Now, if someone is down, let's say for a month or for a year, some of our clients have long-term conditions, and if they were doing like taking care of their home before, and now all of a sudden they really can't do that anymore, they need what we call home care, and that's preparing meals sometimes, shopping, and we don't consider this like a maid thing. We consider this helping them to cope with their illness, really. So often it's a combination of these. Sometimes it'll start out with the real hardcore medical care. It'll move into a longer term of health care, a combination of health care and home care. And like even the table we're on, because I'm also a client, even like the polish on this table was done by our home health care people. And so that just gives you an idea of the kinds of things that they take care of. I also work, and so it's important for me, and my wife needs 100% of the time care. And so they do everything that she used to do for taking care of the home and things like that for me, and I work. So so they not only take care of her, they manage the home. And this has been going on now for me for almost 2 years. And so some of our wonderful caregivers, I always say they know more about how this household operates than I do anymore. So, yeah, anything to add to that?
I think that medical care, what we mentioned, is that once they are in the hospital, nobody wants to stay in the hospital.
No.
Everybody wants to go their home and enjoy. So what we are doing is actually, once they are stable, at least stable to stay in the ward, most of the doctors call us and we'll go to the hospital and check them, and then we will take them home.
I see.
And then we will continue the care exactly what they were following in the hospital, like injections, nebulization, physiotherapy, everything at home. Medications. So we are able to manage them at home instead in the hospital.
Yeah, nobody wants to be in the hospital. I agree with you.
Yes.
Do you also provide end-of-life care?
Of course, we do provide end-of-life care, and we have done, I think, quite a bit since this year, beginning of this year, and we are able to do, because there are some people who are living alone in Cuenca, and the law says that once they passed away, the family has to interfere in the cremation and the process, everything. But now we are able to do that, and we know what to do.
Oh, good.
So, of course, when they are during their end of life, we will be with them 24/7, and we will be contacting their family members if they have anybody left back in the States. And so we are able to do that, and complete care. I mean, end of life, beginning from the care, power of attorneys, and cremation, and the papers, and passport, whatever we needed, we are able to do that. And we have a good connection with the good lawyers who works with the funeral home.
Okay.
So, and of course, we are able to spread their ashes where they want.
Wow, that's nice.
Yeah, and actually, she has just done a lot of this. Last month it was a lung cancer patient who passed away, and we were in constant contact with the family in the States, getting their wishes, taking care of everything. So it was a very sad thing, but we were just thankful that they said, "What would we have done if you hadn't been there?"
I can't even imagine what you would do.
Yeah.
So-
It's hard. It's hard to see someone is passing away, but I think for being a professional in the medical field, we feel happy to be with the person, and we feel proud to say that we were with them when they passed, and they were holding our hands.
Oh, that's wonderful.
So yes, she called me a time or two, and there were tears.
Oh,
I mean,
sure.
she's not made of stone.
You are then able to stay with the patient in home and cover all of their care all the way through the end. Is that correct?
We're able to actually take care of things clear up through to the end of life. There are a few facilities in town that do palliative care. One of the challenges is that they're not really set up to overcome the language barrier that might occur. That's one of the nice things about what we can do.
Well, it's good to know that those options are available out here for those people who want or need that, but it's especially good to know that you all can manage someone all the way through the end of their life. I think that most of us would prefer to go out our own way.
And we have doctors who are working with us, and we are also reaching out to doctors with a new program we have, so that they are also now starting to refer clients to us. We do everything by the book, according to the law, and a lot of companies sometimes don't here in Ecuador, but we do. And so our employees get health care, they get vacations, they get, in Ecuador you have 2 extra months that you pay besides the regular 12 months, so we pay those. And we try and really take good care of our employees. We're very employee oriented, because we think that a happy employee makes for somebody who's going to work well. We have a great scheduling program that we schedule, and then the employees clock in, clock out, and it's geolocated, so we know exactly who's where, when, and they're on time. So we're very much organized, I would say, and we've been doing it now for long enough our systems are pretty well refined.
Well, and you all have a lot of experience too,
Yes.
which helps immensely when starting a big business like this.
Yes. So.
There's a lot of moving parts, I imagine.
Yep.
So tell me, then how does it work? If people want to work with you, they can either start with their doctor, or can they approach you separately?
Either way, yes. So we have some that come from the doctors, from the different facilities, and we also have people who just reach out to us directly and say, for example, I'm having a knee surgery, I'm going to get out of the hospital on such and such a date, I'm going to need some care for that. We have some clients who are like 4 hours a day. We have even some clients who are 4 hours once a week. And then we have other clients who are 24 hours, 7 days a week. And so we have the whole gamut of different people who are recovering from illnesses, from surgeries, people who are struggling with end-of-life issues of various types, and people who are in medical beds, who need complete care. So we do a lot of different kinds of care.
Wow,
Yes.
that's fantastic.
Yeah.
I think the other specialty of VIPs, we work with the doctors for all of our clients. We get connected with them, and they will give what we have to follow, and we will try to work with them so that we know what's going on. So
That's wonderful.
yeah.
And since most of our employees are nurses, we also have an EMT, we have a doctor, and so they sometimes actually ask us to come and assist in the hospital with the client. So we have that complete continuity of care. And speaking of continuity of care, one of the things that we often find is that our clients have a variety of doctors. They might have a physical therapist, an alternative doctor, a medical doctor, various types of doctors. One of the problems is that often happens is these doctors don't talk to each other. And so maybe the alternative doctor's giving an herbal thing that lowers blood pressure, and the doctor's giving something that a prescription that lowers blood pressure, and they never know. So all of a sudden they're taking two things. That's dangerous.
Very
What
scary.
we are is that hub between the various kinds of doctors. And so what Pauline does is she creates a specialized custom care plan for every client. And every day that the caregiver's there, they have this whole checklist that they check off, and then at the end of the day, they communicate with Pauline, who is the care supervisor, supervising nurse, and so we always know what's going on.
You mentioned prescriptions. I know people want to know about getting prescriptions filled here, and what you need a prescription for, and if you can help with all of that.
Oh, definitely, I help with that because we have some doctors working with us in our company, for our company. So, of course, for our clients, I directly go to the doctor and get the prescription, and they will buy the prescription.
Okay.
Yeah. They don't need to visit the doctor.
Oh, okay.
And
That's
especially
nice.
the follow-ups, I take the blood examination results to the doctor, and they give the prescription, and I hand it over to the client.
Oh, that's
And
really
one
nice.
really cool thing here in Ecuador is that the doctors often come to the home. And so Pauline has a number of doctors that have proven to be very trustworthy that she works with. And she just calls them, and they love working with us, so they just come to the home and
that's nice.
take care of things right at the home. Another thing that we're very good at in the home and have done quite a bit of recently is pain medication. We have a very advanced degree of pain medication we can give especially for some of our end-of-life clients.
Oh, that's nice.
Yeah. The major drugs like Pfeiffer and all of Abbott, all those things, you can get most of those here. There's some things that you can't. There's alternative drugs that the doctor will replace with that. But you can always contact us, and we could say we could find out if a drug was available or
Okay.
not here.
I think that's probably what
Yeah.
our viewers would like to know.
Yeah.
Yeah.
That peace of mind aspect of it again.
Yeah.
Because of course it's a little scary to think about coming, to another country.
Yes.
Want to make sure you're going to be taken care of. And
Yeah. We have some pretty modern facilities here of different hospitals
I agree.
and stuff. So wouldn't you say we can do just about any surgery here in Cuenca that you could do in the States, I would say.
Much less expensive, I
Oh,
should say.
most definitely.
Yeah.
Yeah, we've been really happy with the care here. We've had very good experience.
Good equipment, MRIs, CAT scans, I don't know, but all the equipment that they have.
All the hospital bells and whistles.
Yeah. She's the nurse, I'm not. So.
And do you work with both locals and expats?
Do we, Vinu?
Yes. The next stage we are going to start with the Ecuadorians. Now we are getting inquiries day by day, so we're planning to launch.
Oh, wonderful.
Yeah.
We had a couple Ecuadorian clients too. They don't have this idea in their community.
Oh, okay.
So we gave that idea, so they were very, very happy to accept it.
Good.
Yeah.
Yes.
So one of the interesting things when we were setting up all of our contracts and forms and everything to set the company up, the attorney said, we don't have this here. This isn't in the law. We have to make things, we have to use other things to try and make. So this is not in the tradition of the community here. So, but it is starting to be, the need is starting to be there. So we are seeing more inquiries for elderly care, but also there is some demand for pediatric care here as well. So,
okay.
yeah.
I guess I wouldn't have thought about that.
Yes.
Not just the elderly needs home health care, right? Do you accept any types of insurance?
Up until recently, it was not available here. And U.S. insurance, it's hard to bring it across.
Yes.
We do have some contacts who are working on that, who are in the industry in the States. Humana, which is a totally separate company from the U.S. Humana, but the Humana here is evidently starting to cover that. So we're very excited about that. So there will be potentially something. I just learned about that today. So
Oh, how exciting. Cutting edge news here.
I think actually I got the information from one of our clients that they cover the insurance.
Oh, wow.
So maybe we can inquire
will
about it.
definitely
Yeah.
explore that.
Yeah, that's wonderful.
Yes.
Do all your staff members, or do most of them speak English?
Yes, they speak, every one of them speaks English, and all but one of them speaks Spanish as well. So they are bilingual, so they can actually facilitate any problems with doctors here or
Right.
anything like that. So we do a lot of that actually.
Will you go anywhere in Cuenca?
We have clients all around in Cuenca now.
Yeah,
Yay.
and the whole area and the outlying area as well. Right now we have workers all over town. Actually, we have them all hours of day and nights.
And Bruce, I understand that you're also a client.
Yes, I'm part of the management team and started this company, helped start this company. But I'm also a client, and the way it came about, Pauline was working in our home. My wife has rather advanced dementia, and so she was helping, and really she was having a lot of calls for other clients even while she was working here. And finally I said, Pauline, you should start a business. And she said, well, I will if you'll help me. And so together, all three of us started this business, and that's how it all came about. But I personally have home care workers here about 9 to 10 hours every day, 7 days a week. And so I'm very thankful for them. They do a great job, and I would say that the home care providers that I have in my home now have become almost like family. I just love them. That's
awesome.
Yeah.
Well, thank you so much for sharing.
Yes.
And now we're going to meet Kevin and Gabby. They are two of the home care providers. Gabby and Kevin, it's very nice to meet you both. Thanks for taking time to sit down with us today. Can you both share a little bit of your backgrounds?
Okay, hi, my name's Gabby. I am an LPN, licensed practitioner nurse, and I graduated in Florida in Indian River State College. And I lived there in the States for about 11 years. I have a lot of experience in what's in the home health care and also assisted living facilities or in the hospital or any kind of nursing experience.
Wonderful.
My name is Kevin. I am a paramedic. I grew up in the States, so that's where I learned all my English. And yeah, I've been working here for now almost a year, and it's been a great experience. We get to be with our patients, but more than patients, they become our family. You know, we spend months with them, you know, many time, and that's where they become our family members. And, you know, it's just a great experience. And here with the company, with the staff team, it's just great.
Yeah, it sounds like you guys all have such big smiles. I know everyone's very happy, which is fantastic.
Yeah, we're a happy company.
Nice. I love hearing that. Well, thank you so much. This was very informational for JP and I, since this is a topic we haven't discussed that much. Thank you, and I think that our viewers are going to truly appreciate all the information you provided today. What is the best way to get in touch with you?
Well, I think just on our website is probably the best way. And even though our name is VIP Home Healthcare of Cuenca, we've shortened it on the website to VIPcuenca.com.
Well, that is
so,
easy.
yeah, VIPcuenca.com.
Thank you all so much for taking the time to chat with us today. It was great meeting you.
Our pleasure.
Thank you. Ciao.
Ciao.